Adam, good to have you. How do we pimp our brain?
I'm going to tell you that I have a full 8 minutes to tell you everything about the future of our brains and technology. So let's begin. From one perspective, I feel pretty confident saying that a global challenge that we face is improving our cognitive abilities. And I don't mean learning more information. I mean actually the core abilities that allow us to process information. And really the fundamentals of what makes us human. Our memory, our attention, our perception, emotional regulation, decision making, and at the very highest level, our wisdom, compassion, and empathy. And I'd say that right now we are tragically lacking in our ability to do that. So for young people, developing minds, how do we do that? That really falls under the purview of what we think of as education. But there we see almost a completely siloed approach to transferring information content, but not building those underlying information processing systems that a young brain depends upon. For adults, healthy adults, that would fall into the category of wellness, where everything has just been marginalized to being alternative, not really getting the mainstream of our attention. And then in my world, neurology, psychiatry, where we have people suffering deficits, there are numerous problems and hurdles that we currently face. We have very poor assessments. All the advances in brain imaging that we use in our laboratories don't go into the real world. We don't actually know what's going on in your brain if you had a memory problem or an attention problem. But that doesn't prevent us from treating. However, we've had almost a completely focused approach on using small molecules, what we often think of as pharmaceuticals, as the sole approach to improving brain function. And the challenge is that they are poorly targeted. They act generally on neurotransmitter systems, but not on the underlying computational unit of the brain, which is the neural network. And therefore, we always have to increase our doses to very high levels to get the effects that we want, and we wind up getting just as many side effects as we do effects. They're also non-personalized. As physicians, we make our prescriptive advice based on these large population studies that completely ignore all the individual variability of the population. And many practitioners treat a single drug as if it was a holy grail. You have depression, you have anxiety, here's a pill for that. The biggest problem is that they're open loop systems, meaning that there's a very sloppy, non-quantitative cycle between how we treat and how we update that intervention. So you take a pill, you go home, you subjectively monitor your effects and your side effects, you go back to your doctor, and then they go up or down 5 milligrams, right? This is the art of medicine. And it's really ineffective to impact something as complex as the human brain. So, being that I live in San Francisco, we tend to think, can technology help this, right? Is technology a solution? And I'd say in many ways it is. And the reason it is because right now we're really at a phase shift in terms of information technology. So not just the technologies that you all have in your pockets now, but we now have consumer available, or soon to be, virtual reality, augmented reality, motion capture, wearable physiological devices, and AI, other machine learning algorithms. Almost all of this technology is being targeted for entertainment, communications, media. But can these be tools to improve how our brains function? And I'd say on the surface, it's really quite tenable that they would be. And that's because these technologies can be used to create very powerful experiences. And experiences are the gateways to our brain's plasticity. It's the entire basis of learning. It's a completely non-contentious point in neuroscience. Our brains modify itself at every level, its structure, its chemistry, its function, all in response to experience. And we've done a very poor job of targeting experience in a reproducible way. It's what therapy means to do. It's what education itself means to do. But can we use technology to do it in a way that's more deliverable, more accessible, more reproducible? So it's sort of like a hybrid of what we think of as a pharmaceutical, as a drug, and what we think of as therapy. And so we think we could do that by building closed-loop systems in technology. A closed loop is where you intervene in some way, record the impact of that intervention with as low latency as possible, and then use that data to update and refine your intervention. If it was too much, you go less. If it was too little, you push more. You cycle over and over again. At each path, becoming more optimized, more targeted, more personalized to that individual system that you're trying to change. How we build closed-loop systems in our center is through video games. Video games, immersive, engaging technology, the software can be used in a closed-loop system very readily. So how we do it is you play a game, and while you're playing it, the game is recording every aspect of your performance that we can, and we're expanding that. So starting at the surface, how accurate and how fast you are. Based on that data, in real time, the game can give you a challenge that's scaled to your ability and give you rewards in real time. And every game developer knows, this is how you create deep engagement in gameplay, which is what's required to harness plasticity. So the idea is that we could start with that as a core, video games as an interactive form of media to create targeted experiences, and then using adaptive algorithms, we put constant pressure on those brain networks to change them over time. Then we could bring in other technology like motion capture, wireless physiological devices. So we feed more data about you into the game engine, and then we could create even more real-world environments through virtual reality and augmented reality. And we could tie that all together with machine learning algorithms to create a truly integrated multimodal closed-loop system. And this is what we believe will be the future of both education and improving the brain when we have deficits in mental health disorders. To give you one example, 8 years ago, I created our first video game in our center at UCSF called Neurowissenschaftler. Neurowissenschaftler is a multitasking game that we showed that older adults that play it, we improve their ability to play the game, but we also improve their attention and their memory, their working memory outside of gameplay. That these effects are sustainable over months, and that by recording brain activity during gameplay, we learn the neural mechanisms by which that occurs. We now have multiple games that use principles of meditation, rhythm, physical fitness, virtual reality, and motion capture. We feed physiological data into the game engine so that a game is challenging you both physically and cognitively. We now have studies where we record real-time EEG data and feed that into the game. So the game's not just targeting how fast or accurate you are, it's actually targeting how your brain is processing information in the moment to give you a very targeted experience that we think will optimize those systems better than anything that we currently have. So what happens now? Now the goal is to move this technology outside of the academic setting into the real world. I created a company now 5 years ago from my research at UCSF called Achille. And what Achille has done, it's licensed the patent that I filed behind the methodology I just described to you of Neurowissenschaftler. And now it has created multiple games. Now this is a sort of polarizing point because you can't download, as I think someone asked me yesterday, one of these games on the iTunes store. Because what the company has decided to do is take this new game and take it through the highest level of regulatory approval as both a diagnostic and a therapeutic tool. So there are studies now going on in post-traumatic stress disorder, traumatic brain injury, autism, depression, anxiety, multiple sclerosis, Alzheimer's disease, all targeting this game to help improve those networks and resist the negative effects of those conditions. And then the study that's furthest along, that has had the most media attention, is a phase 3 FDA trial. That means it's been submitted to the FDA for clinical approval as a therapeutic device indication for the treatment of children with ADHD. So there are currently 15 sites around the US that are engaged in this trial. If we hit our endpoints, as our pilot data would suggest we do, but we obviously still have to get there, we'll be the first non-drug treatment by FDA approval standards and the first prescribable video game ever. So it'll be an interesting 2017 for us, to say the least. We're now expanding beyond that. Can these games have benefits in classrooms? So we have multiple studies going on around San Francisco Bay Area where we have children playing games that are assessing their cognitive abilities and then mapping them onto the standard academic performance metrics like reading and math. Something that we actually still don't fully understand how they interact. And then when they go home after school, can they play a game to improve any of their abilities that are below what their potential is, to try to level the playing field? And we think this is going to have tremendous potential for disparity issues. And because we have trouble getting doctors and teachers into many places in the world, but very soon everyone will have a mobile device, we think there's an incredible opportunity to help improve cognition around the world. Thank you.
Thank you.